can you tell the audience what do you do?
I am, for a living,
Mm-hmm.
I am a pharmaceutical sales rep. I've been doing that for about 20 years now, actually.
20 years.
So a little while.
Nice, nice. And you also are a competitive bodybuilder, right?
Yes, so I compete in bodybuilding. I'm a professional bodybuilder. Very, very interesting. I got my pro card in 2019, so not too long ago. But I've been doing this for almost 9 years now.
Okay, so how many competitions have you done?
Whew, I don't have the exact amount. I
Okay.
should, but probably around, let's say, 15 to 18, I would say, in total, including regional qualifiers, national qualifiers, and then pro shows.
Wow.
So.
And so I think these diabetic drugs are great. They're kind of showing people the myth between calories in, calories out.
Mm-hmm.
So what is your take on these medications?
So diabetic medication, I honestly think that sometimes they're misused. I believe that's exactly what they're for diabetes.
Uh-huh.
Some people are using it for weight loss,
Uh-huh.
when technically it should be used just for, diabetes, or maybe control of, not symptoms, but let's say cardiovascular protection, or even kidney protection, the different indications that they may have. They are great for what they're used for, but some people mistake that for other things, such as just pure weight loss or fat loss.
Mm-hmm.
And then they also are being used just to help, let's say, in bodybuilding,
Yeah.
right? Not saying that that's a bad thing, but it's just a way of knowing how to control it and how to do it.
You know what? But these medications, they also help decrease hyperinsulinemia, which
Yes.
most of these doctors, and basically, from my understanding, 80% of the population in the hospital is hyperinsulinemia or has a metabolic disease.
Yes.
So just because they're not type 2 diabetic,
Mm-hmm.
they could still benefit. Because I saw that there was a correlation between metformin
Mm-hmm.
and COVID and a higher survival rate.
Mm-hmm.
So a lot of these people are hyperinsulinemia or non-diagnosed
Yes.
type 2 diabetics.
Yes.
So I think it's a very good tool, not just for fat loss. Like we get the fat loss, it's like a added benefit. But I think
Yes.
these medications are really good for health,
Yeah.
because they're decreasing insulin, which insulin is bad, and it just seems like no one talks about the negative effects of insulin.
Correct.
So when you're promoting and you're talking about medication, do doctors talk about hyperinsulinemia?
They do.
Okay.
They talk about hyperinsulinemia, but they talk more about hypo. The reason why it's because they're just more focused on what these medications do in the long run, or if the diabetics don't take it, or if it's a little bit too high of a dose, or if it's contraindicated with another medication. So that's when there's, like, let's say, hypoglycemic events.
Mm-hmm.
You mentioned metformin, and it's interesting what you said, because I know there's studies out there that actually suggest that metformin should be used for more benefits than just, lowering fat or weight, or even A1C. So there's actually doctors out there that say that it should be a medication that most people should take just for longevity and for other benefits. So it's interesting that you said that. But yes, the doctors talk about hyperinsulinemia, hypoglycemia, and all that. But I think honestly, sometimes they just prescribe to drop the A1C, and they're not looking into other things.
And that's a great thing you bring that up, because I've never seen a doctor write up a lab order
Mm-hmm.
for insulin, for fasting insulin level.
Right.
So they're just kind of guessing. So I think it's a little bit unfair. Someone may not be type 2 diabetic,
Mm-hmm.
but their body can be producing a lot of insulin, and they could be at that borderline thing. So if these medications taken sooner could probably could get them not to that point where they're type 2. It can kind of be almost preventative. And I think now, the way diabetes is going, preventative medicine is a little bit, it's,
Yeah.
that should be what we're focusing on. And I think people are against, I know a lot of people are against, there's a medication out there that everyone's getting prescribed,
Mm-hmm.
and they're like, it's a type 2 diabetic, and everyone's like using it for weight loss, a lot of
Yeah.
celebrities.
The weight loss shot. What do they call
Yeah.
it now?
And so it works great.
Yeah.
But you know what? In a way, it's like if we catch it early, then they're not in the hospital. They don't have all these complications, because it's a long-term hyperinsulinemia that increases your risk for kidney damage,
Yes.
Alzheimer's,
Yes.
you know, and the list goes, heart disease.
Yes.
You know, and I think like one of the things is like we're all about heart health. You know, people and cardiovascular problems are one of the biggest issues why people die.
Mm-hmm.
Now these medications are great, and I think we, you know, it kind of shows the correlation between the negative. We've had this fight on fat,
Mm-hmm.
and everyone's like, oh, don't have fat, don't have butter, and don't have bacon. You know,
Right.
and you're like, and so it's like we have this fight against it,
Yeah.
but these medications are now showing that these insulin medications are affecting heart health. So
Yes.
maybe instead of worrying about a low-fat diet,
Mm-hmm.
we need to be worrying about our insulin levels. And I think when most coaches you do, what do they say?
About fat, like
Yeah.
fat loss. Well, yeah, they're more focused on fat loss.
Yeah,
right?
and
and on I guess a balance. So it depends what you're doing it for. Obviously, there's a difference between dieting for lifestyle and dieting for competition or competitive shows or at a pro level even. There's a huge difference, but yeah, it depends on the coach. You know, every coach is different, and this is why it's important to pick the right coach, depending on your goals, I guess. But yeah, they're talking more about fat loss, obviously, and about weight drop.
Yeah, and I think like you know this big push on, you know what, weight drop, and people are taking these these medications aren't even working out,
Yes.
and it's a good way of saying like, what do we tell people like you need to go to the gym to lose weight, but no, it's like this is kind of shedding light to the real problem,
Yes.
which is insulin. So I think that's a huge little thing to think of. But I guess you know what, I'll talk about, I think the next topic is we should talk about your prep, you know, and what's the difference between your lifestyle and your prep diet?
Very different.
Okay.
You would think not, just because you know you still eat prep meals even when I'm in off season or whatever. But kind of speaking on to what you were talking about, you're right. So it's kind of like a good leeway because yeah, people is like, oh, you want to lose weight, go to the gym, but nobody's really saying, do you want to lose weight or do you want to lose fat? Why don't you change your eating habits? So that's huge. But most people assume, oh, I can't go to the gym. Well, fine, don't go to the gym, but why don't you fix your diet? So, to answer your question, the difference between my lifestyle and my prep, it's, I would say, very big. When I am prepping for competition, I really am very strict on my diet or my meal plan. And that includes no alcohol. That includes a certain time for my meals, a certain amount of meals, and a certain weight in my meals. So a certain amount of protein, a certain amount of carbs, a certain amount of fats. I stick to it. And for me, it's like, and we talked about this before, it's like slow and steady for me is what wins the race. So it's a process. So my preps usually last about 5 months. Could be a little bit less, could be a little bit more, but usually I do more than just one competition. So I've done up to, I think 4 competitions almost back to back a year. That was tough, but I've done that. So usually I say it lasts 4 to 5, and then it would continue on just because I'm competing again and again and again. But it's different. When it's just lifestyle, I stick to my meal plan, but I can indulge in things. I can have a glass of wine. I can eat some chocolate if I feel like it. I have my cheat meal or a couple of cheat meals. So it changes a lot. Sleeping is a big factor too.
You know what? That's a good thing you bring that up. I think we don't. Does your coach care about your sleep?
Yes, my current coach is absolutely adamant about you need sleep. So that's like, so when I started with this coach that I have now, I went to him because my body needed a break. My body was actually really messed up from competing back to back for so many years in a row and being so strict. And so, you know, I want to do this about it. So my hormones were a little messy. My body was just reacting. I had gut issues, and my cortisol levels were through the roof. So the first thing was, how many hours of sleep are you getting? And my answer was an average of 4 at night. So, and that's if I'm lucky. So he was like, okay, that's step number 1. So that's huge. And then, you know, he explained sleep is the number 1 factor in recovery, growth, just a good successful workout, a good successful lifestyle, it helps so much your insulin levels. It has to do with everything, but I don't think we know this just off the bat. We underestimate the power of sleep.
Yeah, I mean, like, in the nursing field, I know a lot of nurses like, oh yeah, I haven't slept in a day, or I like, it's like, they work nights, and then they're like, oh, I'm gonna be up all day, and then, night nurses are probably one of the most unhealthiest populations, because you just see them change within 1 year. They gain like 10, 15 pounds. They're like, I'm eating less, but I think sleep is the most important thing, and I see so many coaches not show that value in sleep. They're like, you know what, do your cardio, eat your 6 meals, but they don't ask the sleep question. This is the first time I've heard of a coach actually care.
There's not very many out there. I'll tell you that. And that to me is like one of the things I have learned throughout time is if for me to pick or have a good coach, I know that they're going to care about my health, about how I feel, and not just about how I look. Because yes, of course, that's important. You're doing competitive bodybuilding, but that also has to do with everything else inside of you. So your body's not going to respond the same way. Nothing will, really. But very few coaches care about all that and go to the actual bottom or root problem of things. You just keep throwing things on top to help, like a sleep aid. This, for gut. Okay, let's try the carnitine. Little things like that, which, it helps, but you're not fixing the root problem, for example. So,
what are the kind of blood tests that your coach makes you get?
So, he actually has me do a very extensive panel. So it's not just like what they call the health panel. So we're talking about a metabolic panel, a hormone panel, insulin, fasted glucose, all this stuff. Pretty much everything I think we look for. So it's pretty extensive. Like they take about 4 or 5 tubes when I go do it.
And so like when I was an ICU nurse, like they would check maybe like the chemistry and then the CBC, and that's all they would check. And so I kind of like all these people I have good blood values, and it's like, well, they just haven't found the problem.
Right.
They didn't test everything, and everyone's like, well, my doctor checked my labs, and I think that's one of the biggest things. You go to your doctor and you're just like, well, check my labs, but I think you have to ask for that extra set of labs, like the hormonal panel, because everyone's always saying like, oh, I don't have a weight issue, I have a hormonal problem, but then what are you doing to correct that hormonal problem?
Exactly.
Exactly. Yeah, maybe you're hypothyroidism, maybe you're hyperthyroidism. Like, how are you checking this? Are you just guessing, or are you eating bad, or do you really have hormonal problems?
Yeah, because you don't know until you know, and the blood will show you that. So it's like when I say extensive panels, I mean it.